The broadcast is now starting. All attendees are in listen-only mode.
Welcome, everybody, and thank you so much for joining us here today. We're having our webinar on reopening your private practice. It's with me, and my name is Annie Siegel, the Interim Director of Member Services at NASW New Jersey, and I'm also joined by Miriam Stern, who will be running this webinar and talking to you all about reopening her private practice. Before we get started, I'm just going to have wait a few minutes for everybody to be able to log in and get situated. And a few housekeeping items. If you have any questions, feel free to put your questions in the question box that's on the GoToWebinar dashboard. You won't be able to unmute yourself or come on camera for any portion of this webinar, so don't worry if you have any background noise. We won't be able to hear you and you won't be able to unmute yourself. We will be taking questions at the end, as well as the PowerPoint that you see has been linked in the handout section, but we'll also send more information afterwards. This webinar is being recorded, so please keep that in mind with the questions that you ask. And yeah, I think that's it. We can get started. Miriam, I'm going to hand it over to you, but we still have a few people who are going to be joining us. So.
Okay. Well, Annie, thanks so much to you and to NASW New Jersey for the opportunity to speak with folks today, and thank you to all the social workers who are joining on the webinar today. So Annie mentioned that I run a private practice in Southern New Jersey, and we're a group practice, so we have about 20 therapists who work in our practice, so it's a pretty good size. And we were having a conversation about telehealth and telehealth coverage because the practice that I run, we are mostly insurance reimbursed based. So whether or not insurance companies are covering telehealth is a pretty important topic for us to follow and to be on top of. And I talked to Annie about the fact that our practice actually never closed. We made the decision early on to keep a portion of our practice open, and that was really based on some of the therapists in the practice wanting to continue to see some clients in person, feeling that it was what was clinically best for them. So I think that probably is, I'm in the minority, we're in the minority in our practice for doing that. We had about 25% of our therapists continue to see some clients in person. And mixing that with also providing a lot of telehealth as well. So it was really pretty scary in the beginning, and I really questioned myself every day for the first 4 weeks. I had a lot of trouble sleeping, knowing that there were so many uncertainties about the risks of doing this, but at the end of the day, we felt it was really the best clinical decision, and that's why we moved forward with that. So I'm here to share with you the things that we've learned. I'm happy to say to you that as far as I have any awareness, and we have any awareness, we don't have a single clinician who has contracted COVID, whether working here or not, or outside of here. No one has contracted COVID that we are aware of in our practice, and we don't have a single client who has reported to us contracting COVID who was coming in the office. So. You know, so far what we've done has given us a lot of confidence and comfort that we're, you know, doing, just following best practices. So that's what I'm here to talk about. So we're going to talk a little bit about our experiences, but really more importantly, you know, what do we know? How do we follow the guidance? How do we practice due diligence? And that's really based on a lot of information that has been out there, that is available from the sources that do have it available. Okay, so the next slide was just the overview of today's presentation, and Andy, we're going to skip to the next slide. So here is Gilda Radner's quote: "Life is about not knowing, having to change, taking the moment and making the best of it without knowing what's going to happen next." I think that is a good summary for what we're all experiencing now. You know, this has been a time of extraordinary uncertainty. You know, public health officials, physicians, scientists, the people that we really rely on for information and guidance about how to go about keeping ourselves healthy and not getting sick, don't know a lot about COVID-19. And we have also witnessed this pandemic becoming quite politicized. And ultimately, that's led to, those two factors have led to a lot of inconsistent information and even contradictory approaches by some of our leadership. So what that's forced all of us to do is figure our own way through this. Well, we're a pretty resourceful group of people, social workers, and luckily we've had right from the start great guidance from NASW New Jersey as well as NASW National. And because of their guidance and also consistent consensus on the guidance, that's really helped us social workers navigate through this pandemic. And we have definitely been called upon early on to help people navigate, not just ourselves, but not just our clients, but also the population as a whole. So, one of the things to think about, and this is the next slide, Annie, is that one size does not fit all. In making this decision of whether or not your practice, whether you're an individual or group, is going to choose to reopen is really a complex decision, and there's a lot to consider. It requires all of us to balance the competing priorities that exist, to stay vigilant throughout, and to also remain flexible. As things are changing, as data emerges, we will need to make adjustments in our decisions. And this is going to continue throughout the duration of the pandemic, which I think a lot of us are hearing, we could be experiencing this for, perhaps another 12 months. It's really hard to say. But, the right decision is based on a lot of different factors. And even within each, individual therapist, their client population, as well as in group practices, individuals also are going to have different approaches that are going to be best, that work best for them. So it's really important to individualize and also to empower and support decision making. We're good at that as social workers. We believe in empowering our clients, and we need to also support and empower one another to make the right decision, because there just isn't a singular right decision. Okay, so what do we know about COVID-19 so far? We're about 4 months into experiencing firsthand the impact of the pandemic. So, some folks out there, some of you might be keeping, very close watch on the knowledge. Some of you may be keeping not as much close watch. So I'm just going to go over some of these important scientific knowledge that we have so far. We know that according to the CDC, the virus particles make their way into the lungs through the mouth, the nose, and also through the eyes. So that's really how people can catch and become infected with COVID. And we also know that a buildup of these particles, so a higher volume of particles and longer exposure to the volume of particles, will increase the likelihood of transmission. So that's really why we see, for instance, a lot of healthcare workers who perhaps were not fully protected with PPE, as well as also having prolonged exposure to a lot of the virus. That may be why that they were they were more at risk for developing COVID and becoming COVID positive. We also know that close person-to-person contact, which has been defined as less than 6 feet apart, increases the likelihood of coming into contact with the aerosolized particles. And an extended exposure creates higher risk. So high-risk activities include singing, talking, yelling, coughing, sneezing, blowing, and obviously we're the kind of work we do. There's talking and sometimes yelling, sometimes nose blowing. So those definitely are behaviors that can pose a risk for transmission of the particles. Also, the live virus has been found in saliva, mucus, semen, and in feces. So we have to be aware of that depending on different areas of exposure, including bathrooms. So the attack rate, which is defined as the percentage of people who are going to get infected in a single place, is actually 5 to 19% in households where there has a person who is living there who is COVID positive. So that number actually for me is kind of reassuring, that even if you're living with someone who is positive for COVID, you still only have perhaps up to 20% likelihood of getting COVID yourself. And obviously, if you're taking precautions, it's going to be lower. So, that really means that not every person who is COVID positive is as likely to spread the virus. And also, we know that people who are asymptomatic can transmit the virus. So prevention is about what are the ways that we can prevent catching COVID. Certainly, we know increased ventilation and air circulation indoors decreases the risks, and being outdoors significantly decreases the risks because the particles are diluted. Disinfection of surfaces and certainly more importantly, disinfecting the air when there are potentially particles that have been released, that can decrease the risk. And wearing masks is one of the most important guidance that we get on a regular basis. So wearing a mask will prevent someone from transmitting the virus to other people if they are carrying the virus, and it will also prevent the chance of being exposed to the virus from somebody. So best chance is the best way to practice and lower your risk is to be outside and to be distanced from people and wear masks. But that doesn't help us when we're clinicians performing therapy, because we typically do our work indoors. In the beginning, there's a lot of concern about touch surfaces, high touch surfaces. That's still something that we should be vigilant about, disinfecting the surfaces, but it is now known to be less likely to transmit COVID through that touch surfaces. Okay. Next slide. So here are the 4 areas that I would encourage everyone to really focus on when you're considering whether or not to reopen your office. Health and safety, the health and safety of you, and as first and foremost, as well as the clients and other people in the building. The right clinical decisions, clinical care, what's best to provide our clients clinically. What are the overall risk issues? And also, what's the financial impact of keeping our offices, whether opening them or keeping us on telehealth? So I think we all know this, put the mask on yourself first. I really believe that if we are going to make this decision, we have to think about what our needs as clinicians are first and foremost. We have to feel safe, and we have to be healthy to help other people. So, I think that's really a top priority to be when you're considering what steps you want to take. And I think it's what I know a lot of people I've talked to are grappling with. Okay, and the decision's individual, so we're going to talk a little bit more about that. Okay, next slide. So, health and safety. How do we support the health and safety of ourselves, of other clinicians? What do we know about the risks for certain people, and it's going to be different for everybody. We do know that people who are at higher risk tend to be adults who are older, usually over the age of 40 or 50, people who are immune compromised, people who have diabetes or who have obesity are also at greater risks. So, we know those put populations at greater risks. That includes clinicians in that risk population. It also includes clinicians, household members, as well as their family members. So if you think about, clinicians who perhaps are taking care of older adults and their family, or maybe have young children that they're responsible for, clinicians who might be pregnant, these are all considerations. We also have to think about a health consideration that we know very well, and that's our mental health. Some therapists feel more anxious about this virus, and some clinicians struggle even with high levels of anxiety, with contamination fears. So we have to think about, how do our clinicians feel safe enough to do their work. We also have clinicians who are struggling with childcare responsibilities. Right now, a lot of people's kids are home with them all the time, and that may affect our clinicians' ability to, you know, be in go into an office versus do telehealth from home. May change their schedule. So it's important to think about all of these pieces for our clinicians, and so whether it's yourself or you're in a group practice, you know, those are top priority considerations. We also have to think about our clients. Again, the same factors for them. They have the same risk factors that we have. They have the same considerations for who they live with, who they're responsible for taking care of, who's in their family. And then we also have a responsibility to follow the, you know, keep the health and safety a priority for our local community, in our state, and globally. You know, pandemics spread around the world, as we know, so we really have to make sure that we all take a sense of responsibility for flattening the curve. I think it's one of the most overused statements of the past few months, but that's the reality. So these are all pieces we want to think about when we decide, are we ready to open our offices or not. Then we want to think about the clinical aspect of our care. So, you know, there's a lot of experiences that the past 4 months that many of us have been having with telehealth. And, you know, a lot of therapists are very mixed about our feelings about providing telehealth. You know, so, you know, I think it's really important when you're thinking about wanting to get back perhaps to do in-person therapy, you know, but also, you know, thinking about how things have gone with telehealth. How are your clients feeling about telehealth? You know, a lot of clinicians have talked about not quite feeling that the same level of quality of therapy can be provided through telehealth. And I've heard varying experiences about that, even in our own group practice when we talk about that. You know, some clinicians feel that it's pretty close second, and others feel like it's much harder to connect and much harder to, you know, really do deeper work. So that's a factor. You know, what are the clinical limitations of working in person with restrictions, such as mask wearing? You know, one of the therapists in our office has said that she feels that wearing a mask in person would be more of a barrier than doing therapy through telehealth. So, you know, whether it's telehealth or perhaps wearing a mask, there's questions and concerns about reading affect, about body language, about overall the sense of connecting. I will share with you that most of our clinicians who are working in person have said that after the first day or so of providing therapy with a mask on, as well as having the clients wear a mask, because that's our policy, is that anybody in the building has to wear a mask, that you kind of get over it and it kind of goes to the background, in the same way that the sound screen machines that are in our office, when I'm not in session, I hear them more, and sometimes I find them kind of grating. But when I'm in session, I no longer hear the sound screen. It fades in the background. And I have that same personal experience, and some of us do as well, with wearing masks. So I just want to say that for those of you who have not done it yet, you know, I think it does kind of, it becomes your new normal, and you do get used to it. So, you know, going back to the question of in-person versus telehealth, you know, with telehealth, it's a different environment. You're in the client's home. Perhaps they're in your home. You know, versus being in an office setting that's an established place of therapy. There's distractions for our clients, and sometimes for ourselves, dogs barking, cats jumping on people's laps, as well as sometimes TV in the background. So there are certainly privacy issues, you know, family members that might be around. You know, it's different for different clients. Some clients don't have privacy in their homes. They can't have a private session. We have clients who go to their cars to hold their sessions. And, you know, this also is the case for for child and adolescent clients, they may not have a private place to have therapy, or their parents may perhaps end up being more involved than normal in their sessions, than in-person sessions. We also have considerations such as clients in domestic violence situations or otherwise who are in unsafe situations. For them, having a place to go that is totally private and separate might be critically important clinically for them. And for them, perhaps they might not even be able to have their clinical sessions, their therapy sessions through telehealth if everybody's shut down. So that's a consideration as well. We also, I would say most clinicians do find in-person therapy to be more effective. And there are also certain populations that are more difficult to connect with over telehealth or to do therapy with. Certainly kids and younger kids is a tough population. People with autism, people with disabilities, those folks also might have difficulty connecting. Someone who, maybe perhaps has some kind of impairment with their hearing, which on the flip side can also pose a challenge with mask wearing, obviously, for someone who reads lips. And there's different kinds of therapy that just either can't be done or are very difficult to be done over telehealth. We have a lot of clinicians in our practice who provide EMDR. It's much harder to do EMDR. You certainly have to be more creative. So there's a lot of considerations for making this decision. And then we also have access issues. We have clients who may not have access to technology or internet service or not consistent access. We have therapists who may also have trouble with some of access. We all know that no matter what platform you use at a certain time, it just doesn't work. The sound goes out, the video goes out. Right now, a lot of the health insurance companies are allowing for phone sessions, which helps. But clients who might not be able to afford their phone bill or their internet access, there's financial aspects to access as well. There's so many considerations from a clinical perspective. We also have two other major events that have impacted us during the pandemic. Certainly the pandemic came, and then we had a financial crisis, and then we had a whole change in awareness about racism after George Floyd was killed. And people need a place to talk about this. And for some of our clients, telehealth is a perfectly fine place to do it. But for others, the intimacy of discussing some of these issues may be more difficult through telehealth. And they might, just being in person in an office, it may feel very different in terms of safety, in terms of the safe space, in terms of being able to be open and really process their feelings. So, that's another consideration. We also have to think about the regulations about being in state versus out of state. A lot of states are temporarily allowing therapists who are licensed in other states to practice. So we early on had a client who lived in Delaware and would come to sessions in New Jersey. Well, she worked in healthcare, and once the pandemic hit, she only wanted to do telehealth because of her high risk of exposure. She didn't want to come into our office. And so we had to check and make sure that the regulations in Delaware allowed for our New Jersey licensed therapist to provide therapy, which it did. There are, so those are some of the legal implications of telehealth versus in-person, and also, ethical. If there's no, if the client is used to having their visits covered through insurance, and their insurance company no longer covers or doesn't cover telehealth, then all of a sudden they're not able to get clinical care. So that's an ethical issue. There's also the piece about job satisfaction. Clinicians, we do this work because we love it, because it's rewarding, because we want to help people. And for many clinicians, doing that kind of work on a two-dimensional screen just doesn't feel the same. And our job satisfaction is an important factor as well. And we also know that many people have been experiencing what we call Zoom burnout, with everything needing to be on a screen. That's really impacted our functioning. Many of us talk about how our eyes hurt at the end of the day. There's just real considerations for that. So these are all pieces that affect the clinical work we do, and we want to consider them when we're weighing out whether or not to do in-person work versus telehealth. So, I said one of the next pieces we wanted to look at were the risk considerations. And, that's perhaps one of the, it's a large topic, and there's a lot to think about in terms of the risks. The truth is we've all been grappling with a sense of fear since, I would say, at the latest, early March or mid-March, and the fear of getting exposed to COVID-19, whether it's us or our clients. There's a lot more that we know now than we did 4 months ago, but there's, as we talked about earlier, there's still a lot that is not known. And there continues to be some contradictory information out there. Although I will say, after all these months, I think that things are becoming a little more clear and a little more solidified. We've got to think about kind of two groups of people: the clients and visitors, people coming into the office who are from the outside, as well as the people who are in the office, the staff, as well as any other shared occupants of an office or building. So when it comes to the clients and visitors, we want to remain vigilant to know that someone can be sick and have COVID, and we wouldn't know it because asymptomatic transmission is possible, or mild symptoms also can be present, very mild, without, just not feeling well or not feeling quite right. We also know that it can take up to 14 days for someone to test positive who has COVID. So, there can be a window of exposure that won't be, someone could test negative on a COVID test and still actually be COVID positive. So, there's a pretty long period of time. I mean, in our world as clinicians, that's two sessions, usually, if we're seeing people every week. So, that's really something we want to keep in mind, unfortunately, is that no matter whether someone's tested or not, there's no certainty that they don't have COVID, and especially if they've been around other people. You also want to think about privacy rights. So, HIPAA does allow for an exception to be made if there's a public health risk to disclose information, let's say for contact tracing, but this can get pretty big. We think about if a clinician is COVID positive, who do they need to tell? Do they need to tell the clients who were in the office and when? Do they need to tell, how about if your 2 o'clock client comes in the office and you find out later assessed positive, do you tell your clients from 3 o'clock, 4 o'clock, 5 o'clock? There are just so many ways in which you kind of have to think about how this can get big, and the fact that there can be contact tracing, which is, I don't believe it's required, but it's certainly encouraged. And, the contact tracing starts, I believe, when the Department of Health is notified about a positive test. So, that's a real consideration. There's also the liability that we carry if reopening our office causes a client to be exposed and become COVID positive. We have to do our best, do our due diligence to prevent that. And if we do our due diligence, it's likely that we won't be seen as negligent if someone does become COVID positive. But there's no certainties, even about our liability insurance coverage. So, that's something that is important to be aware of and to look into. And you can find that information actually directly from your liability insurance company. But it's one of the pieces that, again, hasn't fully been vetted out. Of course, we have ethical and moral considerations about exposing us being exposed and other people being exposed because of decisions that we make. You know, people can get very sick with COVID and people can die from COVID. So, you know, we have to really think about what that could look like for us. And, you know, and we have to, you know, consider the types of clients and where the situations they're coming from. So, you know, we have quite a few clients who come to our office who work in healthcare and who've been working in environments where there are COVID positive patients. So, you know, we have discussions with them about perhaps not scheduling on a day that they worked, or certainly not coming directly to the office after work, or perhaps moving to telehealth. So, you know, you have to think about your client's own vigilance or perhaps lack thereof, and how that might impact, you know, whether or not they're in the office and you want to reopen for them. And we're going to talk later about kind of applying your decisions consistently so as not to discriminate. So that's another factor when you're thinking about that. So again, you know, you want to look to your liability insurance to find out, you know, about those risk issues. You know, risk is important to take into consideration. I always though believe that we shouldn't be guided by fear. We should be guided by facts. So, you know, it's something to weigh out and to be aware of, but not necessarily to interfere ultimately with what we think is the right decision for, you know, ourselves, our clients, and for the best clinical care. You know, I learned a little bit about someone's experience firsthand. A clinician that I know early on was working with another clinician who refused to take precautions, refused to socially distance, refused to practice good hand washing and disinfecting. And that clinician who refused to do all those things became COVID positive and got very sick. And then a couple days later, a client called in and left a message reporting that they had been COVID positive. It may have been the transmission, but we're not sure. I mean, it got pretty real when that happened for me to hear that story, and just to know just how quickly things can happen. But also the fact that the clinician who became COVID positive had not been taking any precautions. Fast forward 4 months later, you know, for me to see that in our office, we have been taking precautions and we've been careful about the risks we've taken. And so far, it's worked out. So, you know, in my mind, that helps me understand, you know, the safer way to take risks. So the other population we have to think about are our staff and other people in shared office spaces. You know, so everyone's configurations are different. Some people are in a single office that they're in a few days a week. Some people are in high-rise building where there's elevators and it's harder to social distance. Some people are, you know, in larger office spaces where there's lots of room. There's so many different factors that you have to think about in terms of the type of office structure you have and whether it's shared with clinicians, non-clinicians. Is there a shared bathroom in the hallway? You know, all kinds of questions like that. Again, you know, when the more people in the building, the more possibility for exposure. And so, you know, again, the window of testing is 14 days. You know, part of this is also about whoever you're in an office space with, whatever building you're in, you know, do you have confidence in the practices of other people in that office who are sharing spaces with you? You know, are they cautious? You know, the example I gave a few minutes ago about the clinician who became COVID positive was sharing a space with a clinician who was vigilant, who was social distancing, who was disinfecting. And that clinician never showed signs of getting sick. That clinician didn't get tested because this happened pretty early on when there wasn't a lot of testing available. So, you know, it's also who are you sharing space with, and are they on the same page? There's also liability. If you work in a group practice, you have to think about, you know, the liability if you're making decisions for the group practice, you know, if you have employees, and if they get sick while working there, working under your leadership, you know, there may be issues around, you know, do they have paid time off for sick time? Perhaps there's actual legislation that's being talked about for workers' compensation for employees who get sick on the job from working on the job, they're exposed on the job. You may even want to think about something called employment-related practices insurance. So through your liability insurance, if you have employees, you may want to think about adding that in, making sure that you're covered if something happens and someone wanted to actually take legal action against you, whether an employee or, So there's just all kinds of unknowns about this. But, again, we just want to be vigilant and make the best choices we can. Hopefully I haven't scared you too much. I want to talk about policies and procedures. These are some of the things that putting them in place shows that we're doing our due diligence. It's important to have and to maintain updated written policies that protect the health and safety of staff and visitors based on regulations on the local level, the state level, and the federal level, as well as best practices. So, that is something that will, is a way to make sure that things are done consistently and effectively, as well as protecting yourself from a liability perspective. It's certainly important to have, basic policies, and I would say things like social distancing practices in the office. Are you going to be health screening people before they come in the building? And if so, how will you do that? And also, what's the frequency of disinfecting that you're doing? What is your method for disinfecting? These are all things that you want to have decided and hopefully in writing. So, and then you want to make sure that you are training everybody who you have contact with in the building and staff, other clinicians, on whatever policies and procedures, whether you're a solo practitioner and you just write them down and put them in place for yourself and you share them with office mates, or if you're running a group practice, that you make sure that everybody in the practice has access to this information and has been shared with them. And then also that you're documenting that this has been shared with them and that they're in agreement. So even if you're a solo practitioner, just documenting that these are your practices and policies and these are the ones that you're following, just keeping track of that, it shows you're doing your due diligence. If it's with a group, you may even want to have people sign like an attestation, or we have in our policies and procedures in our office, when we update them and we have new ones, we email them to the staff and ask them to sign off on them. So, and even something as simple as even documenting a conversation, or perhaps just emailing the information and ask them to respond to your email, some way that you're showing that you're, following some kind of procedure with that. And again, if you're going to reopen, you want to think about what kind of signs do you want posted, that are visible enough and relevant enough. I caution people not to make them too scary seeming, because that doesn't help anyone when they're trying to come into a clinical office to hopefully decrease their anxiety. We want to think about the wording and be careful about that, but it's helpful to have signs. And then it's important to have consent forms. I mean, we always have consent forms when we initiate treatment with our clients. We have consent forms for releasing their information. So in this situation, I think many of us have, put out consent forms for telehealth. If we're going to reopen, we also want to have a consent form, informed consent form that talks about the reopening risks and procedures. NESW Assurance, that's our liability insurance company, they offer an informed consent form that you can just download off their website. And if you can always look to your own liability insurance if it's a different company and see what they're using, and they'll guide you on that, which is really helpful. And also, you want to document in the client's record that they signed the consent form. You want to document that you've had a discussion with them about the policies, the practices, the risks, and stuff. And occasionally, you probably want to reiterate that and keep that in the record. So, it's just a good practice of ensuring that you are not being negligent, but you're practicing, best practices. So the fourth item I said we really want to think about is the financial considerations. And I actually asked Annie, I had put this slide way at the end of the presentation, which I thought was kind of interesting when I thought about that. Why did I do that? probably because as social workers, we don't usually focus on the financial part of our work, but it's an important consideration. And I want to give it its due. So we moved it to where it probably belongs, which is as the fourth consideration. So, we need to recognize that as clinicians, we need to have reliable income streams. We don't go into this work to make lots of money, but we have to be able to afford to live and to pay our bills. So, when we're thinking about the pros and cons of the financial impact of doing telehealth versus in-person work, that's a factor to think about. Even though for those of us who take insurance or insurance networks, even though the state has regulations for mental health parity for telehealth, for parity for telehealth that has to be covered, not all insurance plans fall under the regulations, which is why some insurance plans are covering telehealth and some aren't. And it's kind of a case-by-case basis for some plans, although in the past couple of weeks, it's become much more clear that most major insurance companies have extended their telehealth coverage. I know a lot of the insurance companies follow the guidance of the Center for Medicare and Medicaid Services, CMS, which governs what Medicare does. And Medicare currently is having the telehealth coverage through the waiver during the public health emergency. Annie let me know the public health emergency expires July 25th and will likely be renewed again for another 90 days. A lot of the big insurance companies have come out with public statements and on their website saying that they're continuing to cover telehealth. So, for in-network providers, that's a relief. It gives us a little more time to decide what we're doing, or more importantly, just to be able to kind of, if we want to reopen our offices to some degree, to still, lower our risk by providing a mixture of both in-person and telehealth. Some of our clients, especially if they're self-pay, may not be as willing to pay for therapy. If it's through telehealth, they may not feel they're getting the same value. So that's a consideration too. And also for clients who are covered by their insurance companies, many of the insurance companies are covering the cost sharing. So clients don't have to pay their copay if they're doing telehealth, but in-person sessions they do. So that may be a factor for them as well. We also have to think about the financial cost of reopening our offices. Inevitably, there are probably going to be increased costs, whether we are providing masks and PPE for our clients, for ourselves, whether we are deciding to pay for a text health screening tool that checks in with our clients to make sure that they're, there's a list from the CDC about like a screening tool about what are questions to ask before people to make sure they're not, having symptoms or at risk. There's text services that we can use for that, or we might spend time making phone calls and checking with clients before they come in about that. So that could add, cost of time and services. Many of us have to change the way we use our office space. For instance, in our office, we have closed down 2 of our smallest rooms that don't have windows because the ventilation is just not adequate, and we can't socially distance properly. So those 2 treatment rooms can't be used. So that automatically decreases our, ability to serve our volume of clients. And overall, we are decreasing the number of people in the building at any given time, which means that we have to, we're automatically going to be having fewer in-person visits than normal if we're doing in-person work. So that's a consideration as well. And also the cost of, purchasing disinfectants. If we have to change our ventilation system. I have a colleague who has a back door in her office that goes to the woods, and she has paid to have a screen installed so she can keep the back door open and have the screen there for more ventilation. So there's just all those considerations. So, I think many of us have seen, if we're paying attention to some of the news stuff, issue of the pandemic is not just a public health issue, but has also become somewhat of a political issue. You know, we have to really keep ourselves out of the political side of things in our professional lives regarding our practices that are best health practices. So, you know, the best way to do that is to make sure your decisions about how you're going to work are based on, you know, that there's policies, procedures, and practices that are based on public health guidance and science rather than opinions or political orientations. You know, it's best to develop consistent practices and policies, and whenever possible, if you can have more people who occupy the same office space be on board with those practices and policies, it makes it more less personal and just more kind of you know, data-based and also consistent for everyone to follow. When you know, we live in New Jersey, and in New Jersey, our governor's been pretty rigorous about this public health emergency and putting out specific guidance. You know, for us to be able to say to our clients, you know, masks are required to be worn indoors in businesses, it kind of takes any debate out of the discussion if our clients are, you know, for any political reasons don't want to wear a mask. Now, we can make exceptions for health reasons. Obviously, the government does, and we can too. But the more that it's not just I, as a clinician, I'm telling you I want you to wear a mask versus this is our practice, this is our policy. It just helps to depersonalize and take away some of any debate that might be there or any political agenda that may be weaving its way in. And of course, it's important to always implement any policies, procedures consistently and uniformly to avoid bias or the perception of bias. So just a couple more slides. So before opening, you know, you want to plan how this is going to work in your office if you're going to reopen to any degree. You want to increase physical distancing in the building. You want to look at waiting rooms, break rooms, entrances and exits, flow of traffic, and furniture placement. So in our office, we've removed most of the chairs in our waiting room. We only have a few. That's one way to do it. You know, we've made sure that our offices all have enough physical distance, and we've, as I mentioned, we've closed a couple of our smaller offices. You want to always limit the number of people in the building and in the rooms. And you also even want to look at like bathrooms and, you know, shared spaces like that. You want to schedule accordingly. So scheduling, you know, fewer people to be in the building at the same time. You want to have your waiting room procedures pretty clear, whether clients can wait in the waiting room or have to wait outside, and whether you may decide to limit non-clients in the building, so not have family members wait, you know, or not have get other people other than clients and staff in the building. You want to post the signs, as we talked about, and do whatever you can from what I've learned, to improve the ventilation in the building. So we open windows during our sessions, and we're in a place that it doesn't affect privacy, but one of our offices, if we were to open that office and use that office, it could. So we would consider putting a sound screen outside the window, outside the building, or right next to the window. You want to look at your HVAC system, make sure there's good airflow, and have disinfectants available if you can purchase them. We use Lysol, and we do spray the air after our clients leave. We also try to weave in-person and telehealth appointments so that we're not back-to-back with clients in the same office. In the same office space, we sometimes, you know, we'll have a client and then a telehealth visit and then a client and then a telehealth visit, et cetera. So having that plan in place and thinking about how to do that safely. There's also some new technology coming out that they're looking at that might kill the virus, things like UVC, or it's called far UVC devices that kind of zap the air with UV rays. They're not safe for prolonged exposure to humans, but perhaps short bursts. It's being used in other places as well. And there's something called vacuum UV. There's also HEPA air purifiers. So I would encourage you to just do the scientific research on your own if that's something you want to consider. And then after opening, once you're ready to open, you want to make sure you're screening, you know, at least verbally, your clients and staff using CDC guidelines about the questions to ask. Some people will temperature take, Again, it's really personal and individualized for how people want to approach it, but just have some kind of procedure in place for some screenings, even if it's just a discussion. Masks are required in small businesses in New Jersey. You know, some people, there may be workarounds for that. We require all of our clients and all of our staff to wear masks when they're in the building. When someone's in their own office, they may take their mask off if their door's closed and their window's open and they're by themselves. That's fine. But when they're with clients and they're around one another in public spaces, we're always wearing our masks. You know, again, limiting the number of people in the building at any given time, that might require changing schedules. Encourage frequent hand washing. You definitely want to regularly disinfect high-touch surfaces because the virus can be on the surfaces. We think it's a very low risk, but still, you know, you want to mitigate as much risk as possible. And then, you know, considering if you can get hold of Lysol, if you research some other types of ways to kill the virus in the air, you know, that's ideal. And then also just document after, you know, at your first visit that you've just discussed the risks, you have the client sign the consent forms, et cetera. So communication is key with clients and with staff. Obviously, there's a lot of individual factors here. You want to make sure you're honoring your clients' wishes of whether they want to return to in-person or not. If you can and you feel comfortable with it, you want to communicate the plans ahead of time and the expectations for returning. You're providing, you know, again, verbal and written explanation of the procedures, so there's not confusion or there's not a break in the procedures, and also that if they get, you know, if they're showing any kind of signs of sickness, you want to let them know that they can cancel their appointment with no penalty. We want to continue an open dialogue on an ongoing basis as things change and as reminders. We posted in the presentation, I think it's perhaps at the end, there's the NASW has a great consent form you can use, and your liability insurance may also, and, you know, having your signs posted on the walls. So that's on the client side. With the staff, you definitely want to have, you know, discussions both maybe perhaps as a group and individually. If there's more than one, if you're in solo practice, that's not needed, but if you share the space with anyone or if you're part of a group practice, you know, it's important to validate. People come from different perspectives and have different fears and uncertainties. Others feel very comfortable. Ultimately, you want to be, you know, making the right decisions based on an individual basis, and honoring, you know, people's right to decide how they feel most comfortable practicing at this point, if you can. Some situations, some circumstances, clinicians, you know, don't have a choice. The services need to be provided and they must return to the office. But whenever possible, trying to, you know, be thoughtful about how you know, you do that. And you want to, you know, make sure that the verbal and written consents, you know, the information is continuing to be shared about policies and procedures. And then, you know, making sure people know, you know, that if, you know, if they do get sick, what their options are. Do they have any sick time? Can they, you know, do they have, you know, workers' comp? You know, you want to be aware that if you're running a group practice, and you also want, you know, people to know what their options are. Okay, Annie, I think we're there. You know, that's kind of an overview. My concern about presenting all this information was it might really be kind of scaring people off about providing in-person services. You know, however, as I said from the beginning, we have been doing this all along, and we've been successful with it. And I think if you're vigilant and you follow the science and the best practices, then it really, reopening your office can be done safely. And you just have to kind of continue on with practicing carefully as you go and be ready to change as needed. So I'm happy to answer questions and be part of a discussion as people have questions. And the last page has some references and resources for you to click on.
Thank you so much for all that great information, Miriam. We have a bunch of questions that we can kind of go through, but please continue to send them in. The PowerPoint will be emailed to you all. It is available in the handout section, but if you can't access that, that's no problem. We're going to email it as well. So I'm just going to stop sharing my screen because we're done with the PowerPoint. And just give me 1 second. So the first question is, you had mentioned dated informed consent, and so your clients, someone had asked, are your clients signing up dated informed consent specific to COVID and releasing your practice of liability, and then as well as are you having the clinicians sign the informed consent as well, or just the client?
So we are actually, we actually haven't done a written informed consent. That's actually, we're in the process of getting that to our clients and starting with that. So it's actually newer for us as well. I will tell you though, whether it's clients or staff, the reality is that there's no 100% release from liability. There's no guaranteed release from liability. I mean, that's true in everything we do. I will say that following best practices and mitigating risk as best as possible, doing your due diligence, that's really what the insurance companies ultimately will have to look at. I mean, I think if people are flagrantly ignoring CDC guidelines, state health guidelines, it puts you much more at risk for being found liable. But this is kind of, to some degree, uncharted territory, and it's still being hashed out, even with, you know, whether workers' comp is going to be, for businesses, is going to be covered, you know, whether people will be able to file for workers' compensation if they've gotten sick on the job. That's still being discussed, I think, is legislation at the state level, and it's being looked at the federal level. So, you know, the answer is we are putting those things in place. We've had verbal dialogues with all of our clients, and we document that about the risks. And we, and with our therapists, we have a couple of therapists who want to come back in. We have more clients who've been asking to come back in. So that, you know, initially we hadn't put anything in place because we never closed, but now that there's more out there and there's specific forms, we'll be using them.
Great. So we've had a few questions about, you know, what your specific policies are in your office. So if you wouldn't mind going through, you know, what happens from the time that the client enters to the time that they leave, and, you know, what you do. And
so when our clients come in for their appointment, the therapists are very rigorous about bringing them right back to their office so that they're not in the waiting room for more than a couple of minutes. And some of us actually have clients who wait in their cars. We haven't instituted that across the board, but that's actually, to me, preferable. We have instituted, we are not allowing anybody to wait in our waiting room who is not there for a session. So it's a little tricky if we have a parent and a child, but even so, if the child's in session, the parent will wait out in their car. Once the client has to have a mask when they come in the office. I think I might have, I'm not sure if I mentioned this earlier, but we did have a client who was waiting in the waiting room without a mask, which is the first time that happened. That was about 2 weeks ago. So, you know, we addressed that with the client, and a client who was leaving and saw that was very worried and uncomfortable with that, rightly so. So we had a specific conversation with the client who sat without the mask and said, you have to wear a mask in our office. It's just a requirement that we have. The therapists do, for the most part, spray the air with Lysol after clients have been in their office. They always sit with their windows open. That's something all of our therapists are doing. And they all have offices with windows, luckily, so that's helped. And our therapists are also sitting as much possibly distance as possible. We've moved some of our furniture around. It's not always 6 feet. Not all of our offices have a full 6 feet, but if a client is on one end of the couch, the therapist will kind of diagonally sit as far away as possible on the other side of the, you know, away from the couch. So, you know, we do our best. We do also spray the furniture with Lysol, and we have a special furniture spray. I mean, I think it's, you know, it's hard to know how effective all of that stuff is. We've started looking into the UV lights, whether or not if we have more. Right now, we have about 25% of our clinicians working in the office. A couple more have expressed interest in coming back. If that starts to happen, we'll probably have a higher level of consistent disinfecting by like using a UV light or something. And we're frequently, the therapists ourselves, we go and we spray the door handles down and the doorknobs. And I spend a considerable amount of effort in the beginning, early days of the shutdown, trying to find out where I could procure disinfectants and, you know, Clorox wipes and Lysol spray. And I've been able to find a good few sources, as well as masks. Now masks are pretty available, luckily. And we have hand sanitizer in every office. Hand sanitizer is now more available as well. And we have like hand sanitizing wipes that we have in our waiting room, so people can, you know, open the door when they leave if they want. We also have we have two offices, and one of our offices has a door that leads down the hall to the treatment rooms, and we now just keep that door open all the time. We don't close that door anymore, so it's one less handle to touch. We frequently disinfect all of the touch areas in the bathrooms, and I hope I've touched. Annie, did I miss anything?
No, I think
and just to say, we do have regular conversations with our clients about their health status. Has anything changed? You know, are you feeling well? And we review that, and we remind them to alert us. We have text reminders that go out to our clients in the beginning, and email reminders. We had a message on it asking them to cancel their appointment or let us know if they're not feeling well. So that's something that's kind of it was an easy thing to change and almost no cost to us to be able to use that. We're not using specific health screenings. I know a practice in the area that is having all their clinicians call their clients ahead of time to health screen them on the phone. We're not doing that, but and we do have the conversation. I mean, we're a pretty close-knit group in our practice, and you know, our therapists are all very well aware that if they're not feeling well, they're just to cancel their in-person appointments and provide telehealth or you know, be out sick. So those are the ways that we've been doing things. And you know, I didn't specifically talk about this, but you know, we know as clinicians that fear and anxiety increase with a lack of exposure. We know that exposure therapy is one of the, you know, tried and true best practices for anxiety issues. And I have to say, you know, working in person was very scary in the beginning, but it's gotten much less so, to the point where we're still very vigilant in our practices, but the fear is really gone. And I would say most of us have experienced that shift about 8 weeks in, when we started to see that what we were doing was working. And I think fear is a huge factor for most therapists who've been working remotely and are considering returning to the office. You know, it's just a scary proposition when you haven't done it. I felt the same way about the grocery store in the beginning. I used to be very afraid and anxious. I felt like I was gearing up for battle when I went to the grocery store, and I don't feel that anymore, but I'm cautious, and I still carry hand sanitizer with me, and I still wear my mask, and I'm still careful about where I touch, and I still distance in the store. I know there's been a lot of, you know, shutdown fatigue, so some people have become kind of swung to the opposite end of vigilance, but we really, in our office, and I know personally, really try to remain vigilant and do what we can. That could be because it works. So far, it's worked.
Are you doing temperature checks at your office, and how does that work?
No, and I specifically have made the decision that we are not doing that, because my understanding from the science is that there are people who can have no fever or such a low fever, that you wouldn't be able to be sure, you know, that they didn't have any symptoms, so they could still be COVID positive. And B, there's been a excuse me, a wide level of accuracy for thermometers. And I've talked to people who work in hospitals, who, you know, tell me that they go in and that they do a temperature scan, and their temperature is varied by a degree or two every time. So I think, you know, the accuracy is my concern. I don't know that it's the best measure. But there are many people who are doing temperature checks, and they feel that's a good practice. And again, it's very individualized. Just for us, that hasn't been an area that we feel is enough benefit to use.
And I do just want to say to everyone who's asking questions, we have received a lot, so we're going to just get to the amount that we can get to, but we may not be able to get to all of everyone. So I'm sorry if you're asking a question that we can't get to. Next question we have is, are you using face shields at all? Have you considered face shields? Is there a reason why you are or aren't using them?
We have considered them. Again, this is kind of where I think a personal comfort level. Our therapists are comfortable with masks. I think they haven't expressed comfort with face shields. And I think that some of the research does show that the virus can be transmitted through the eyes. So face shields would help to mitigate that. Also glasses or goggles can help. But we have just felt like the masks were definitely the most consistently supported covering, for to protect against the virus, and we've gone with that. But I have seen folks who've used face shields, and I think they're a great option, and they might be right for some clinicians. I think for some of us, the masks were easy to adjust to as a non-interfering device or protection. I don't know, face shields, clear face shields might also feel like less of a barrier for some people. I'm not sure the level of barrier that it would provide. I think I'd probably rather wear glasses or goggles to protect my eyes and a mask. But I think part of it is a personal comfort level. And if I saw strong evidence that said face shields were highly recommended, we would move to face shields no matter what, if there was enough evidence to support that.
We've had a lot of questions as well about bathroom protocols, recommendations about sanitizing after each use, or are you just not letting them use the bathroom? How are you handling that?
So we have we have 2 bathrooms available to our clients in our offices, and we currently never have more than 3 clinicians working in the office at a time. So the volume is very low for clients coming into the office and using the bathrooms. I would say we are doing our best to sanitize after each client uses a bathroom. I did mention, and I apologize if it's a little bit vulgar, but there is virus shedding in the feces. So there's new information coming out and suggestions perhaps to encourage people to close the toilet lid when they flush and if they're using the bathroom. And we've started to look at that as well in terms of, do we want to just suggest that to our clients, and if they're using the bathroom, do we want to have a sign in the bathroom? But as we are letting our clients use the bathrooms, and we are disinfecting on a pretty regular basis all the touch surfaces, the top of the soap, the handles, the faucets, the flush lever, the seats, and we have paper towels. We disinfect around the touch areas of the paper towel dispenser. We're not having a lot of clients use the bathroom actually, so I guess it helps. And I'm actually a little more vigilant about the staff bathroom because the staff are here all day. So when they're here and there's more than one person here, we're really trying to disinfect. And we don't have like Lysol wipes, for instance, sitting out in the client's bathroom, but we have all of our disinfectants on the counters in our common areas. And a lot of the therapists keep the disinfectants in their office. They keep Lysol spray and Clorox wipes. I want to say right now, we're also not seeing younger kids using any kind of manipulatives or toys in person. Right before the shutdown, we had started to move to removing our sand tray because of the touch area, and also only using toys with a single client, child client, and crayons, and everything that we would use, we would disinfect after session and remove it and then use a new batch. So trying to not reuse items client after client, but disinfect them in between. and bring new items in. I know people in this area who are doing sanitary therapy with kids in person, they might be using gloves. So just to talk about specifically working with things that are being touched by clients in session, we offer EMDR, and we disinfect the tappers that are used. We also are trying to have therapists more and more. It's not always the case, but open the doors and close the door handles so there's fewer people touching the door handles, just to mention that. I know you specifically asked about bathrooms. Hopefully I answered the bathroom question.
Yes, it definitely did. What platform are you using for telehealth?
So we use an electronic record system called Theranost, and they have their own telehealth platform, which I think has been as good and as bad as any other. We are also looking into using the HIPAA compliant Google platforms, Google Meets. We're actually going to move all of our email over to the HIPAA compliant Gmail, and with that, apparently Google Meets is free as part of that. So we just need a backup, because even though some of the HIPAA compliance rules for telehealth have been kind of suspended, and we're allowed to use FaceTime, we're allowed to use Skype, it's really not the best practice, and we need to have a better option on the times when our own Theranost telehealth platform isn't working so well, which seems to be very variable. So that's what we're using. I know a lot of people are using Doxy.me.
Mm-hmm.
We haven't used that. My sense is that all the platforms have, pros and cons in terms of the consistency. So
we've had a lot of questions as well about disinfecting and sanitizing cloth furniture. And so do you have that issue in your office? Some people said, should we put like a sheet down and then replace it after every client, or, how do we spray it or clean it?
So, early on, the only thing I was able to find was like a Tide fabric spray that was supposed to kill viruses. But then it left the fabric wet, so that wasn't very good. If you have the option to, as much as possible, to use a non-cloth fabric, but as you can probably see behind me, we have, there's a couch that's right behind me, and it's a fabric couch. So again, I think the low transmission likelihood is reassuring for us, but we do generally, try to spray our couches with Lysol in between. We have several treatment rooms, and they're not all being used at the same time, so sometimes we'll actually move rooms. The greatest risk is from my latest research, which is just my own that I've done, looking at the reliable sites, is that the time frame for how long particles stay in the air and when they fall to surfaces, and how the surfaces are just not the big risk at this point. I'm much more concerned about the air, that the airspace that's between the client and the clinician. So for me, that's where the Lysol comes in, which personally, I'm not a huge fan of the smell of Lysol and having it sprayed all the time. And I think about that too, but at least it provides some protection, and then it can, also can be, used on fabric. I don't think that's a great concern. I think the air is much more of a concern. And again, there's been anecdotal evidence, some research evidence, but also anecdotal evidence of, people who were COVID positive, who had high exposures to lots of people, but the person who was COVID positive and the other people were all masked, and in those circumstances, there's been very low to no incidences of transmission. So I think the masks and the airflow and the distancing are the key, most important components from what I understand from the science.
So when, deciding about resuming in-person services or remaining in person, are you offering this to all clients, or how are you making the decision about which clients to do telehealth, which clients to be, in person, especially if you have clients with comorbidities or, other health issues?
So we are offering this across the board to all clients, all adult clients for the clinicians who are working in person. So we have some clinicians who've not returned to the office, who are not ready to return to the office, don't feel comfortable for their own health and safety reasons. And that's tough because some of their clients are asking if they can come back in. And they could come back in, but not to see that therapist who's been their therapist. So it's that's a little bit tough that there's inconsistency among, different therapists and therapists, but at the same time, the therapists who are working in person are offering in-person services to the clients that want it. It's not, we don't every session say, necessarily, do you want to come in person or telehealth? We tend to stick on the same path with our clients, unless we're hearing for clinical reasons that one is, better for them than the other. We had a client today who was planning to come in person, and she actually has a serious medical condition that causes great fatigue. And she said, well, I really don't think I can come in. I just don't feel well today for my medical condition. So the therapist, was nice enough. We could offer telehealth as an alternative now. But in general, it's across the board consistently. I do know some therapists who have clients that they're more concerned about in terms of their hygiene practices, in terms of their exposure. And I think you just have to have a pretty honest clinical conversation with your client about that, like if they're high exposure. We have, like I said earlier, we have a number of clients who work in healthcare. I have a client actually who I'm seeing tonight who works in an outpatient medical office. And from when she started resuming in-person appointments, I did ask her if she could please go home and at least change her clothes. And perhaps, I know a lot of healthcare providers who go home and shower right away and change their clothes. And so she honors that. And that's a relationship that we have, that we can have that conversation. But, you can't discriminate against your clients. But if you have concerns about their hygiene or their exposure practices, I think it's an important conversation to have. And you certainly have a right to say, I think it would be better for us to reduce the risk for you and for me and other people here by continuing with telehealth. I mean, I think that's a reasonable conversation to have, but you have to be careful about not discriminating against people too.
Great, and that touched upon another question we had about, if you have a client who is not practicing social distancing, or maybe doesn't necessarily believe in the science around, transmission rates, and so they're, typically not necessarily practicing good hygiene. But
yeah, I mean, and I will say we have, I think generally we live in a pretty, I'm going to say, democratic leaning state, but we have all kinds of clients who come into our office with all kinds of beliefs, and specifically all kinds of political beliefs. And, we do have clients who are adamant that they, just don't believe the science. They don't, but interestingly enough, even those clients, we had one of those clients last week, and he called to say that a family member of his who is working in a high exposure area had a potential exposure, and he said, I am going to not come in. I'm going to do a telehealth session because of that. So even though he is not someone that we see as being vigilant or concerned, he still followed our policy and the procedure. And I think that's where having it verbalized and written and reviewed on a regular basis with our clients, and having it not be a political issue, just saying this is how we're doing things here. It seems to help with that. And I'll also just say we have purchased disposable masks, and we have them available. I think we've had to give a mask out once or twice in the 4 months. It's been very rare because our clients are coming in with them. But we do have them available for people. And quite honestly, if someone didn't want to wear one, we would just say to them, we're going to move to telehealth instead. We're just not going to violate our policy and our practice because of someone's discomfort with it or belief system. That's just, and I was talking to a clinician who works in another state and in a rural area that is a very strong, the population very strongly follows and supports President Trump. And, a lot of people around there won't wear masks, and she's in a shared space. And, we were talking about the fact that if the whole office space just has a practice, and she doesn't have to just say to her clients, I'd like you to wear a mask. Instead it can be just the practice of the office space, a requirement of the building or what have you. It takes some of the pressure off, and it makes it more easy to follow uniformly with everyone and enforce.
So we have a question about, when you were talking about financial considerations, someone had said, was there a period of time that you offered any lowered fees, or also copay waiving from insurance doesn't necessarily cover all of the client's plans? Did you make accommodations?
The answer is absolutely yes. So quite honestly, we've 22 people who work here, and that means that 22 families are relying on this place to keep going. So when the government was planning to shut down, or when the governor said he was going to shut down the state, and at that time, most of the insurance plans that we accepted did not cover telehealth. It was really scary financially for the clinicians, for myself, and it was worrisome in terms of the clinical care. So what we had planned on was offering very low cost phone sessions, and applying that as well to telehealth, which you have to be normally you have to be pretty careful about, because you have to uniformly apply your fee. You can't, a lot of us do a lot of, sliding scale fee work, but our contracts with our insurance companies say that, if we charge one rate, we have to charge it to everybody for the same service. But that Medicare actually allows, and they set the standard, remember, so they are allowing a waiving of collection of copays, coinsurance, et cetera. So we offered a very low fee service that I knew would allow us to continue providing services for our clients, as well as provide income for our therapists. That was a really important priority, and it allowed us to keep going. Because a lot of our clients in the beginning said, well, I'll wait 2 weeks and then I'll come in when we reopen. And of course, we all know that, look back on that naively, but that's the best we knew back then. Quickly, most of our clients moved to telehealth, and within 2 weeks of the shutdown, we had almost all the insurance plans that we deal with agree to cover telehealth, maybe 2 or 3 weeks. And through the duration, actually through June 30th, tomorrow, we have continued to offer that low fee coverage. We have quite a few clients who've lost their jobs, some who've lost their health insurance coverage, and we have been able to, because we've been in stable financial standing, we have been able to make accommodations for all of our clients who needed them. We are, as of July 1, we are no longer going to be offering that very low fee telehealth or phone session, really because it's covered now by almost every insurance company. It has been for a while, unless the client has a financial need, in which case we will continue to make that accommodation. I want to also just share from a financial perspective, for those of you who haven't looked into it or haven't considered it, there's many options out there for independent contractors and small businesses for financial help through the CARES Act and through the Small Business Association. So our practice did apply for and did receive the PPP loan, which we did as obviously a small business, but you can do as an independent contractor if you're a solo practitioner. And that money, if you get it, has to be used to pay your salary, but also can be used for rent expenses, for buying PPE and adjusting your office. I think the deadline to apply may be tomorrow, and the application goes through a small business, through a bank, especially if they're a small business lender. So if you haven't done that, that's an option. There's also the disaster loans, the EIDL loans. There's other loans and monies that are available if people need it. And I know there's been a lot of need even in our own therapist community. So that if you have been impacted financially, there may be ways to get other help, financial help, to offset some of the losses. But yes, we did experience overall our income. Compared to our number of visits, our income has been lower compared to the number of visits we've had, although our visit numbers have been pretty high. They were lower in the beginning, the first few weeks, and they've crept up. And we've actually had a very high show rate too, which I guess makes sense. People are home and more available and not running in different directions and missing appointments. Many people weren't at offices working. So yeah, I mean, it's an important consideration. We've been able to make that accommodation. Not every practice can, not every practitioner can, and I understand that.
Thank you so much for that. I do want to be mindful of everybody's time. We are, quickly approaching 2:30. So I do want to just let everybody know that we're going to be emailing out the PowerPoint if you aren't able to access it right now, as well as a copy of the recording so that you can watch it after the fact. There's all the great resources that Miriam had mentioned are on our website, naswnj.org. We have them on our COVID-19 page, as well as linked to, the national NASW COVID-19 page, the informed consent we mentioned, and then some other guidelines for reopening practices that, reiterate a lot of what Miriam had said. So thank you so much for taking the time today to share all, what you're doing in your practice and your wisdom with, navigating something that nobody has ever done in the history of the world. That's really what we're doing right now, making history with, all of the things that we're doing. So please feel free to reach out with any questions. It just may take us a bit to get back to you because, we are very inundated with lots of questions. I know everyone's curious about licensure renewal. Just to briefly touch on that, letters have gone out from the board. I've heard that many people can't actually renew. The website is not allowing them to, so we've reached out. So we're hoping that that'll get taken care of in the next few days so that you can all renew your license. But thank you so much, Miriam, again. And, everyone's in the questions box saying thank you as well.
Oh, thank you. My pleasure. And Annie, I mean, at the risk of giving you extra work to do, I'm really happy to, if you want to send me a list of other questions that people submitted or end up submitting to, I'm happy to continue to try to hopefully answer questions best I can. I mean, I'm answering it mostly from, the information that's out there as well as our experience. Hopefully I've not scared everybody off from opening up their offices, but giving people some encouragement that it can be done safely and carefully and successfully. Just to close, I think, from my perspective, I think social workers, we're really important people in this pandemic. We're going to help. We've helped, our society navigate this pandemic, and we're going to continue to be a very important, contributors to that. So, hopefully people can feel empowered for the work you're doing. And I want to just also really say again, like NASW in New Jersey specifically and NASW at large has been a real beacon through this, doing something that you've never had to do, that none of us have ever had to do before, and really helped me also specifically from the beginning feel very confident that there is, some guidance and help out there. So hopefully we'll continue. I can be a part of that as well. So.
Well, great. Thank you so much again, Miriam. And
thank you.
I'm going to X out of the webinar and everyone will be kicked out, but stay tuned for our email. Thanks.
Okay, thanks. Take care. Bye-bye.